Welcome back, audience. We have Dr. Carl Gonsoulin with us with Gonsoulin and Gonsoulin in Lafayette Dentistry, and we were talking about some of the implications about teeth. You know, you've heard everything from heart disease to diabetes, just general overall health when it comes to teeth. What's some of those things, you know?
Well, first of all, what's the purpose of teeth? The overall survival purpose of teeth is to prepare the food for digestion.
Right.
Okay, so you need to chew the food, eat the food, and it makes it easier for you to digest the food, so the body can now get as much of the nutrient value it can get out of the food you eat. That's the first thing. Okay. Another thing is looks, of course. Okay. All right. Another thing is speech. Okay. Now, the major role of a dentist when he's taking care of the younger child is to take care of the problems that exist, but get them in a condition where they are no longer in decay and have the knowledge and ability to keep themselves that way, no longer in a diseased process. Now, there are other things besides cavities. There's gum problems, there's malalignment of teeth, you know, where braces are needed, things like this. A lot of braces are caused by losing baby teeth early, losing permanent teeth early, and now these teeth have to be put back in position because they've erupted into the, or, you know, came into the wrong position, something like that. And a lot of it's caused by just grandma's teeth and grandpa's jaw, and they don't fit right, okay? So braces are very important in getting these teeth lined up properly so they can function correctly. You know, these teeth have to do a lot of chewing for a lot of years. Okay, they're meant to last a lifetime. They're not meant to be worn out or lost. But if they're not lined up properly, you don't have the teeth working as a unified group. You have a few teeth doing all the work for the rest of the mouth because they're the only ones that hit properly. So having the teeth lined up properly is a very important thing. That'll help them hold it better, help the gingiva, the gums hold it better. Okay? And then the gum disease, which is one of the main reasons people lose teeth, is that's where you lose the area that holds the tooth in the mouth. You can have a beautiful tooth, but if there's no bone or gum to hold the tooth in the mouth, you're going to lose it. But there's an infection there. But it's a very insidious, it's a very sneaky type of infection. You don't notice it there because there's no pain involved in it. There might be a little bit of bleeding or something like this, but if you took a person who has badly infected gum and you put all that infected area on one spot on his arm, he'd have the size of a baseball there, infection. Now, go through life with that much infection going on, even though it's not hurting. This is bacteria going in the mouth, getting into the body on a constant basis, okay? Well, that can't be healthy for the body. No way. And that can, if there's a weak spot in the body, these bacteria are liable to find that weak spot. Now they get a foothold and you got some other problem, okay? So those are the important reasons why you want to take care of the gums. You brush and floss the teeth, you take care of the gums, you take care of the teeth. The clean gums cannot decay, cannot have gum disease unless they have some incorrect alignment that needs to be adjusted or something like that. And clean teeth cannot decay. It's just whether can you get them clean enough to prevent all the problems, and you may not be able to prevent all the problems, but the few you can't prevent are minor things that can be taken care of very easily. And you don't have to go through all the problems it takes to fix it, to pay for it, and all this other stuff, you know. So prevention is the route, you know. But nowadays things can be done so much better than it used to be. That these fillings can last well, these crowns can last well, these teeth can be replaced, but it's still not as good as the real thing.
Sure, sure. Well, Doc, we got a few seconds left, and you might want to tell everybody the other dentists in the adult dentists in your office and what the orthodontist name.
We have a new addition to our office, Dr. Lisa Williams, and we're very happy to have her with us, and she's there to help out with our adult patients, the kids that are getting older than for me to see, and anyone who would need any kind of help. Dr. Joey Porter, he's our orthodontist. We're really happy with him. He does a very good job with his orthodontist. The kids like him a whole lot. And we're very pleased with the work he does. And so we're able to do more for our families than we could in the past, and we're happy to do that.
Great. Well, okay. Well, audience, thank you for joining us on Healthwise. Thank you, Doctor, for coming and talking to us about this. And remember, if y'all out there Mardi Gras this weekend, be careful, be safe, don't eat too much candy. And if you eat, you know, I mean, I know you're going to eat some, but just eat it in moderation. And have a good Mardi Gras. See you next week on Healthwise.
Healthwise is brought to you in part by Opelousas General Health System.